Gentleman reserves, the gentlelady from California is recognized.
Mr. Speaker, I yield myself such time as I may consume.
Gentlelady is recognized.
Mr. Speaker, as families across the country are being crushed by rising costs and stripped of their health care, it's shameful that Republicans have chosen to bring a bill to the floor that does nothing to address these crises for pregnant women and families. Instead, the bill before us today would allow temporary assistance for needy family, or TANF dollars, to be used to fund so-called crisis pregnancy centers that have a proven track record of intentionally lying to, misleading, and endangering women. And it is no coincidence that this bill is being rushed to the floor this week as Republicans once again prioritize appeasing a national anti-abortion group in town for its annual rally instead of addressing the real crises facing American families. I want to paint a picture as to what happens to a young woman who suspects that she may be pregnant. She has a mix of emotions. She may have overwhelming fear and anxiety, especially if she has few resources. So she goes to what she thinks is a medical center or clinic, and it's called a pregnancy center of some sort. When she gets there, she's greeted so warmly with open arms. There are people in white coats who she assumes are medical professionals. They tell her she can get so many things for free: pregnancy tests, ultrasounds, pregnancy counseling, and after the birth, even free diapers and formula. It all sounds so wonderful to this woman that she says, "Sign me up." But they don't tell this woman that in order to get these free services, she has to first sit through an ideological or religious indoctrination session in which all the reasons to not have an abortion are given. They don't tell her that the person administering the ultrasound has no medical credential, and in fact, this is not an official ultrasound, and she could be misdiagnosed. They don't tell her that half the personnel in the so-called clinic have no medical credential at all, and therefore are not equipped to advise on any medical complications such as an ectopic pregnancy. They don't tell her that this is not a medical clinic at all. In fact, because it is not, this woman's privacy is not protected, and her information could be shared with the public. The real world of the crisis pregnancy centers is exemplified by an OBGYN in Iowa who's seen patients who visited these centers and were told that using contraceptives was the same as having an abortion. She's seen patients who suffered miscarriages and ectopic pregnancies because they were misdiagnosed by these anti-abortion centers. These women were told that their pregnancies were in the early stages or that they were experiencing normal amounts of pain because these staff members that they saw were not actual qualified medical professionals. As a result, these women ended up in the hospital needing emergency care and surgery to save their lives. In Illinois, a woman seeking an abortion was deliberately misled by a fake clinic. She was subjected to graphic videos, told that having an abortion would make her infertile and ultimately mentally ill, and ultimately she was coerced into carrying a pregnancy to term. After giving birth, she lost her job and health coverage, and the so-called clinic never offered real medical care or follow-up support. And this is why the American Medical Association and the American College of Obstetricians and Gynecologists have raised serious ethical and medical concerns about these clinics. And now, Republicans want to guarantee that taxpayer dollars through these TANF funds will fund these centers and that there will be no accountability for these dollars. Now, let's first be clear what TANF is actually supposed to be for. TANF exists to help families experiencing poverty meet their most basic needs and stabilize their lives so parents can work and children can thrive. TANF was never intended to subsidize anti-abortion propaganda or unregulated sham clinics that endanger women's health. Yet that's exactly what this bill does. Not only that, it goes beyond the regular TANF program, which requires reporting and accountability. And actually, this bill says that nothing shall be construed to restrict TANF funding for these centers, meaning that funding could not be taken away from them even if this center engages in deceptive practices or even causes a woman's death. When the Ways and Means Committee marked up this bill last week, Democrats offered common sense amendments that should have been uncontroversial to anyone who cares about women and families. We simply propose that TANF funds not go to pregnancy centers that have engaged in deceptive or misleading practices that provide medically inaccurate information or that have endangered the health of a woman seeking care. We also offered amendments to address the real crisis affecting the TANF program, which is the Trump administration's decision to seek revenge against 5 Democratic governors by preventing them from accessing $10 billion in already appropriated funds for TANF and childcare. And Republicans rejected every one of these amendments. Clearly, this bill is not about supporting pregnant women and families. It's about shielding deceptive actors, supporting Trump's revenge tactics, and using public funds to advance an extreme anti-abortion agenda. If Republicans truly cared about pregnant women and families, we would be debating how to undo their $1 trillion cut to Medicaid, which rips health care away from millions of pregnant women, new mothers, and children, and how to help the millions of women seeing their health insurance premiums skyrocket due to months of Republican inaction. Instead, this bill is merely an attempt to distract from these devastating realities with the ultimate goal of appeasing the anti-abortion advocates parading around Washington this week as countless women suffer and die under extreme Republican abortion bans. Their priorities are clear and profoundly misguided. I urge my colleagues to vote no. And Mr. Speaker, I reserve the balance of my time.
The gentlelady reserves. The gentleman from Missouri.